Meeks, and that'll be our last question for the set of questions. Dr. Miller-Meeks, you have 5 minutes.
Thank you, Mr. Chair, and Secretary Becerra, thank you for testifying before the committee today. HHS's budget summary document asks for a $5.2 billion increase in healthcare fraud and abuse control program funding, specifically listing cutting-edge data analytics to detect trends and outliers. In a Senate Finance Committee hearing, you mentioned that the President's FY 2024 budget request bolsters HHS's healthcare fraud and abuse detection and enforcement work. Furthermore, HHS's OIG, Christy Grimm, stated in her confirmation hearing that she is committed to expanding HHS OIG's use of sophisticated data analytics, including leveraging artificial intelligence and machine learning to proactively monitor and address fraud, waste, and abuse in the HHS programs. Both in the Healthy Future Task Force for the Republicans, as chair of the Modernization Committee, I talked a great deal about artificial intelligence and its use in detecting waste, fraud, and abuse in the Medicare system. I'm currently drafting legislation that would require Medicare to use advanced algorithmic technologies such as artificial intelligence, machine learning, and predictive modeling to combat fraud, waste, and abuse in the fee-for-service program. Estimates of healthcare fraud range from $50 billion to $300 billion annually, and unfortunately, OMB and GAO have identified Medicare as an at-risk for improper payments. According to a 2015 OIG report, every dollar invested in AI fraud detection yields $5 of savings, highlighting the need to invest in this technology. I support the use of AI in improving program integrity, but want to ensure that AI technology is not misused to deny legitimate patient claims. Mr. Secretary, how can we apply lessons and AI innovations from the commercial and Medicare Advantage space to root out fraud, waste, and abuse in Medicare fee-for-service? And will you commit to working with me to responsibly strengthen HHS's fraud reduction capabilities?
Congresswoman, we would absolutely look forward to working with you because everyone is still trying to figure out how we can make the best use of AI and make, as you said, use it for the right purpose where we can probe, but not for the wrong purposes where we might exclude people from care. So very much would look forward to working with you because we know there's a lot of fraud that's going on within the Medicare system.
Yes, as a provider, there is fraud within all of our systems, and we don't want to deny legitimate patient claims. We want them done in a timely fashion, and we don't want to delay provider reimbursement. Let me also echo the sentiments of other individuals and other representatives in this chamber this morning. I took care of my mother with Alzheimer's the last 2 years of her life, and I would say that for CMS to deny coverage of a medication that has been shown and approved by the FDA that could benefit those with Alzheimer's, I think we can, you said that we don't want to cut spending in Medicare because we want to provide people access to care. And I would say we can ration care, and it's another name for cutting spending. I also want to, as a physician, express my displeasure at CMS's rule on surprise billing. We were very specific in the law. I was not one of those members of Congress, but followed that very closely, was very supportive of the legislation that was passed, and it was done in such a way to make sure that the rulemaking process followed what we were passing in legislation. As a provider, as a doctor, we feel that the comments we've had back from HHS and CMS have been less than satisfactory, and I would strongly recommend and encourage you to revisit the rule on surprise billing and make sure we're protecting providers and patients. Thank you very much. I yield back.
I thank the gentlelady for yielding back. And Mr. Secretary, that concludes all members' questions. We really appreciate your time and your effort